Welcome to ENT 360. In today's episode, we're going to understand what are adenoids and how it impacts a child's life. More importantly, how do we ensure we take care of it and help the child grow really amazing? To do this, I've got ENT surgeon Dr. Prashanth Reddy. Welcome, doctor. So, doctor, when we talk about stuffy nose in children, some children who have stunted growth and crooked teeth, are these related symptoms?
Yes, so the stuffy nose, the crooked teeth, stunted growth, and also ADHD is all related.
How are they related? Are they caused by one thing, or is it one child having multiple issues?
So it's like one issue which is causing all these symptoms, is what I would put it as. And the one issue which is causing this is the adenoid tissue, which would have enlarged, or the hypertrophied adenoid, which is seen in the back of the nose, obstructing the back of the nose, causing all these symptoms of stunted growth, stuffy nose, ADHD, bedwetting, and also tossing around in the bed.
So, a lot of these things happen because of adenoids.
Yes.
Then, adenoids, are they really required? And what are adenoids?
So, what are adenoids? Adenoids are the third tonsil which is present in the back of the nose. It's above the soft palate, it is in the back of the nose. So, this adenoid tissue will increase in size because of recurring infections, because of allergies, usually. And very rarely it can be because of some tumors, but that's ultra rare. So, what are adenoids? Adenoids are normal tissues which are present in the back of the nose, which is seen in kids up to the age of, say, 12 years or 13 years, which will start shrinking by the age of 7 years. Before that, it will be big, then it starts shrinking because the lymphoid tissue will get segregated and you will have your tonsils and other gut lymphoid tissue which will take its place. But if kids are having recurring infections or allergies, this adenoid tissue won't shrink in size. That leads to the adenoid tissue to become bigger and leading to further obstruction of the nose, on back of the nose, leading to these various symptoms.
So, if I understand it right, it's one of the first defense mechanism of the body, right? Like the immunity of the body, the first tissue that helps against a lot of diseases a child could face. But in time, it needs to reduce in size and go away. If it doesn't, it causes these issues.
Exactly. So it is actually acting like how your tonsils are in your throat, which are required for kids less than 7 years because they tend to put everything into the mouth. So in order to prevent the germs from entering your gut, tonsils are present to prevent the body from getting attacked by various harmful bacteria. The adenoids are present in the back of the nose to prevent the same kind of mechanism, to prevent the inhalation of germs into your lungs and other issues. But that being said, if the adenoid tissues enlarge quite big, it becomes grade 3 or grade 4, that leads to the obstruction in the back of the nose, leading to the kid developing difficulty in breathing, having recurrent issues because the natural flow of the mucus is backward. From the sinuses, it goes backward. So if that pathway is blocked because of the adenoid tissue, that flow doesn't happen, and that leads to the stuffiness of the nose.
So, doctor, as a parent, how do I know that my child has this problem?
So as a doctor, I would ask the parents a few questions. The first question is, does your kid mouth breathe?
Okay.
The second question would be, does your kid toss around in the bed too much? Third question I would ask is, how good is your kid's focusing ability? Fourth question would be, how fussy a eater your kid is, because kids have who have adenoids or other issues, they have very low appetite because their stomach is filled with air. Fifth question which I would ask is, how at what height is your kid compared to his or her friends at school? So all these factors accumulate to the issue of adenoids. So these things are a few questions which I ask the parents, and once they answer this as yes, my kid doesn't focus much in studies, he keeps running around, he or she keeps running around, can't focus.
So, doctor, when we talk about physical ailments that definitely necessarily need a surgery, many parents are concerned when we talk about surgery for kids, right? Is it always necessary in kids or even in grown-ups that a surgery is really required?
So when a patient comes to me, I need to assess the patient first and foremost. Many a time, I will first examine the patient physically, then I'll ask for a few radiological examinations like an X-ray or depending on what is the patient profile. So I will assess if it's a kid who's having nose blocks and snoring issues. I will ask for an X-ray to be done, X-ray of the back of the nose, wherein I can assess how the third tonsil or the adenoid, how big it is, how much of an obstruction is happening, what is happening. I can assess it with an X-ray. So once I see that, and only if I feel that it requires a surgery where the adenoids are more than grade 3 or grade 4, then only I'll advise them a surgery. Once I see the X-ray, if there is no adenoid enlargement, then I will just put them on a nasal spray. The nasal spray will act on the tissue, whatever is remaining, if it's grade 2 or grade 1, and it will start shrinking it further, reducing the allergies, and the kid will feel much more better with just a nasal spray. Only if it is grade 3 or grade 4, I would advise for a surgery for the adenoids to remove the adenoids in toto, because if it's grade 3 or grade 4, the spray doesn't have that much of an effect in reducing or shrinking it in size, because even if we use it for 3 months, there's not much of significant reduction in the size of the adenoid tissue. So that's when I will advise them to go for a surgery. Otherwise, sprays usually will take care of things in pediatric snoring issues. In adult snoring issues, I will again assess the patient. I will see the patient physically. I need to see their throat to see how much of a collapse is happening, if and also how long is the soft palate. If the soft palate is not very much elongated and the collapse of the side walls are not much, then I will advise them a few lifestyle modifications which will reduce the chances of their acid reflux, which is one more cause for their snoring, and also the tongue falling back. So I will advise them to change their lifestyle slightly. I'll give them a proper diet plan. I will also ask them to sleep in a particular position, which is an inclined position where the head is up and toes are down. So all these factors will ensure that the patient doesn't snore much, and without surgery that can be fixed, provided there's no physical obstructions which I listed out in the throat or in the nose, which is causing the snoring.
In kids, generally, more than the patient, because the kid doesn't know a lot about these things. They're not scared, right? But when we talk about the parents itself, they are more concerned, more worried about the surgery. So, how serious are some of these surgeries? When you talk about adenoid tissue, right? Is it something which is very complicated? How do you resolve it? Or when we talk about pediatric cases, you said that certain exercises, certain things can resolve. Which do you recommend? Again, how do you do it? And how do you manage the parents?
So again, everything is dependent on the X-ray. So X-ray of the nose, back of the nose, is very essential for me to decide whether the patient is going for a medical management or a surgical management. So even though I'll advise them surgery, I'll first put them on medications to ensure that the adenoids can shrink to the maximum, trying to avoid the surgery. And only if in case the surgery is not, the medical management is not showing the results which I desire, then only I will suggest them surgery. Otherwise, just the medical management will take care of things. Coming to the surgical aspect, once the medical management has not yielded result, when I ask them to, then the surgery is advised. So for the surgery, it's an endoscopic surgery. There won't be any cuts on the face. So an endoscope is a thin rod which goes in through the nose, and I'll visualize it on a bigger screen, and I will be operating. So when I'm operating that also, I'll be operating in such a manner that there won't be any cuts on the face, zero cut, zero scar, zero bandage surgery. The bleeding also will be minuscule amount, because before the surgery I'll be putting the patient on medications to ensure that the bleeding is controlled before the surgery itself by reducing the vasculature inside the adenoid tissue. So that leads to the adenoids to bleed lesser when I'm operating. So that way, it's a ultra minor surgery for the patient's perspective because one, there's no pain. Two, there's no downtime. Three, there's no cuts. Four, there's no bandages. Nothing. So the patient will come with a blocked nose. The kid especially will get up and he'll have a breathing much more better. His appetite will increase. His ability to gain weight will increase. All these changes you can see post the adenoid surgery.
But with the adenoid surgery, you mentioned that the kid can walk in, get the surgery done, and walk out, right? What is the recovery time in these cases?
So the recovery time for an adenoid surgery is basically a very short duration. Within few hours after the anesthesia wears off, the kid is up and running. There's
Okay.
zero downtime.
Any bleeding or anything else that could occur?
So very rarely the bleeding can occur, which is the only proof that I am operated. But 99.9% there won't be any bleeding, especially in adenoids, because I would have controlled all the bleeding points before I get out of the uh, before the patient wakes up. So that way, I ensure that the bleeding is fully controlled before I descrub or once the before the surgery is over.
Yeah, because when I said the reason I'm asking these questions is trying to understand from the parents' point of view. See, as a child, they may not have known what happened, right? But a parent, when they see a drop of blood, I think
They
they
panic.
will feel more pain than what would they experience if they were bleeding themselves, right? So that is the reason I want to understand. So when you talk about adenoid surgeries, they're much more simpler from the patient recovery point of view, right? Compared to any other surgeries also.
True. So that's why I told this is an ultra minor surgery from the patient's perspective or the parent's perspective because no cuts, no scars, no bandages, no downtime. Patient comes in, patient comes out. Patient won't. I mean, because of the anesthesia, the patient there might be some amount of irritability because of which the kid would cry. But as such, there won't be any major issues from the patient's parents' perspective for taking care of the kid.
So talking about recovery for the kids, right? So obviously the symptoms go away. Could you just walk us through some of the symptoms that parents can see immediately go away?
So the first thing which the parents will see that the kid is able to sleep much more peacefully without tossing around in the bed. The kid appetite will increase drastically. The kid will get more hungrier because the metabolism will increase. The kid's focusing ability will increase drastically because the ADHD factor, which is the attention deficit hyperactivity disorder, which is quite common nowadays because parents will tell the my kid is unruly because he's not sitting in one place. That kind of reduces the focusing ability will increase because the oxygenation of the blood increases. Their height will start growing. Their ability, if at all you have a kid who has bedwetting and other issues, that will also go away because the nose breathing improves, so the stress in the body reduces, so the chances of the corticosteroids levels, the steroid levels in the blood reduces, so the chances of them urinating in the in the bed reduces drastically. And other things which you can notice is the mouth breathing which was happening will significantly reduce. The snoring will totally reduce fully. uh, when the kid, because the kid is used to mouth breathing, the kid can tend to open the mouth and breathe, but as a parent you have to just close the mouth and the kid will sleep silently. So these are the changes which you can notice immediately after surgery.
That is what I was going to ask. That a person who's used to breathing through the mouth, as soon as the surgery happens, I think the body takes time to realize that now they can freely breathe through the nose. Are there any additional things? One, as a parent, they could try to close the mouth. Would you recommend taping the mouth in those cases?
More than mouth taping, I would advise you to just tie a muffler around the head and the chin. That is much more better than taping a mouth because even if you tape a mouth, it's again uncomfortable and there'll be a lot of secretions which can be pulled up in the mouth, which can lead to a choking sensation. So a simpler one would be just tying a muffler around the chin to push it up and that way it's much more better than taping the mouth, because taping of the mouth, the chances of, especially in kids, swallowing it and choking on the tape is more of a issue. So my advice would be just to
Use a
tie a
muffler or monkey
muffler
cap or
or
something
monkey
like
cap
that that
around.
holds it up.
Yes.
So when we talk about this in children, this is one of the predominant factors which will impact ADHD, right? Like you mentioned, not being able to breathe properly causes them not to sleep properly, and all these issues happen. Are the chances of misdiagnosis very high here? Because I think parents panic, they end up googling or talking to a neighbor, and so many other things come up, and they show us symptoms. Are the chances of misdiagnosis very high in these cases?
Yes, they're extremely high because not many people have correlated ADHD to adenoid hypertrophy. Not many people have correlated loss of appetite to ADHD. Not many people have correlated stunted growth to adenoid hypertrophy. Not many people have correlated your bedwetting to ADHD. Not many people have correlated the other factors like them tossing around in the bed to adenoid hypertrophy. So definitely yes, they'll diagnose this as something else when the root cause is one single cause. So the root cause of all these things is the adenoid hypertrophy, which is leading to your ADHD, your loss of appetite, your inability to gain weight, your inability to have stunted height, the mouth breathing and dental caries. That is also because of your mouth breathing. The bad breath which is happening, that's also because of your this one, the adenoid hypertrophy. If the kid is burping too much, that's again because of adenoid hypertrophy, because of the swallowing of the air. So multiple causes is because of the adenoids.
And I've seen some instances when a dentist will know, looking at the structure of the teeth, right, the way they appear, they will also be able to find out that it could be something related to adenoids. So would it be easier if a dentist, I mean, generally parents are more comfortable taking their kids to a dentist than taking them to a ENT or a cardiac surgeon, right? So would it be nice if they could also identify these symptoms instead of just focusing on realigning the teeth?
So dentists do take care of things. So if before they put in a retainer, the dentist will definitely ask them for a ask the kid to assess the adenoids, because the adenoids, if it's blocking the nose, that leads to the kid mouth breathing. Because of the mouth breathing, the palate will go higher. It won't be flat; it will become high arched. So when the high arching of the palate happens, the teeth will go forward. That leads to the malalignment of the teeth. So the dentists who are putting them on a retainer will definitely ask them to get an X-ray done to assess the adenoids, and many do refer the patients to me saying that okay, the adenoids have to be addressed. So that's something which the dentists do assess. But again, as parents, they should know that the root cause for all these symptoms is the adenoids, and then address it accordingly.
So when this happens, how does a parent decide? Because if it's teeth realignment or misalignment of the teeth that is causing, maybe that's some physical thing that we could look at. Any other things that parents could observe and then take them to a ENT?
So the first thing which a parents can observe is their nose, the stuffiness of the nose. If the kid is having recurrent colds, recurrent coughs, recurrent bouts of fevers, recurrent throat pains, then yes, that's the first sign which is pointing you towards there's some issue in the nose which needs to be addressed. So that's the first time when you can come and get a ENT consultation done. Other issues can be, again, as I mentioned, the symptoms: loss of appetite, tossing around in the bed, bedwetting, ADHD issues, inability to focus on things if there's a task given. So all these factors is something which the parents can look at and then address the nose and take a call. Other simple thing is if the kid is snoring, that's again the adenoids which is the cause. And if the kid is mouth breathing, again it's the root cause of the nose. So we need to assess what is happening and again take the calls.
Thank you so much, doctor, for helping us understand how adenoids can impact a child's life so much and how important role it plays. in their growth as well. Right? Thank you so much.